All right. Well, at this time, I'd like to welcome those who have registered for today's Blue Ridge Health District COVID-19 Town Hall, along with those who have tuned in to view the live stream. My name is Joe Rice with the City Communications Office. We are hosting this Zoom webinar, and I'll be moderating today's Q&A between our BRHD representatives and the community. Just a few notes before I hand it over to Jason Elliott, the Blue Ridge Health District's Deputy Public Information Officer. After the presentation, we will give our registered attendees an opportunity to ask the panel questions. And we'll do this in the format of one question each. We will host one round of questions, and if time permits, we will go into a second round of questioning. But we will look at time consideration there at that time. As always, please keep your questions respectful and thoughtful for all of our participants. We appreciate your participation, and with that, I'll hand it over to you, Jason.
Thanks so much, Joe. And thank all of you for being here today. Welcome to the Blue Ridge Health District's Town Hall on May 13th. And we've got a whole lot to talk about today, and I'm very excited to have a wonderful panel with you. As Joe said, my name is Jason Elliott. I'm the Deputy Public Information Officer for the Blue Ridge Health District. And today I'm joined with a couple of individuals that you may know and a couple of individuals that you'll be happy to know today. We're joined by Dr. Denise Bonds, our Health Director for the Health District. We're joined by Ryan McKay, who's our Incident Commander for the Blue Ridge Health District. And we're also joined by two local pediatricians, Dr. Carlos Armengol from the Pediatric Associates of Charlottesville, and from UVA Pediatric Health, we have Dr. Jeffrey Vergales. So we got a lot to cover today, and we got a lot of questions we know coming from all of you. But before we get there, Dr. Bonds is going to start us out with a couple of updates on vaccine efforts and some new dashboards. Dr. Bonds.
All right, thank you. If we could have the slides, please. If we can go to the next slide, please. So as Jason talked about, we're going to give you just an update on where we are with the vaccination efforts. I'm going to orient you to our new vaccine dashboard. Ryan McKay will then give an update on the JCPenney site, our vaccination efforts for 12+, and then we'll be happy to take all of your questions. If I can have the next slide, please. So here is where we are as of today. You can see that for the entire health district, we have administered over 230,000 doses of all of the different vaccines. This includes both Pfizer, Moderna, and J&J. We have 138,000 individuals with at least one dose, so individuals who have at least some protection, and we have just over 100,000 individuals that are considered fully vaccinated. I do want to put a plug in right now for encouraging everyone to really keep that second dose appointment. If you have been vaccinated with Pfizer or Moderna, you don't get the full efficacy or the full protection until you've had that second dose. So it's really critical that you come back and see whoever you got your first dose from. And if you did get it out of state or in an area that's really difficult to get back to, you are more than welcome to call and schedule a time to come get it at the JCPenney site, or you can drop in on any of our hours. If I can have the next slide, please. We do have new dashboards on our website. There's a screenshot here. This data comes from our state database system, and it gives you the number of individuals that have at least one dose across the entire district, people who are fully vaccinated, and percentages of each of those. There's a second page that provides demographic information that you can look at as well, that provides information on race and ethnicity, by age group, and by sex. And I'm going to turn it over now to Ryan to update you on where we are at JCPenney's.
Thank you, Dr. Bonds. Joe, if you can push it to the next slide, please. So we have been operating out of our site here at JCPenney since late March, and beginning in mid-June, we will stop operations here at this location. One of the things that we've noticed over the last 3 to 4 weeks is a pretty sharp decline in the number of first dose appointments that have been made. And while we've seen a small uptick recently, given the new access for 12 to 15-year-olds to Pfizer, we continue to see some of those numbers drop. And we project that come mid-June, we're not going to be utilizing the full space here. And so it's a good opportunity for us to sort of transition from a very large location here at JCPenney to really focus on some more outreach and mobile efforts to make sure that we're getting to people in different neighborhoods, we're going to where people are, and that we're doing really a lot around education so that we can get over sort of the hesitancy that may be out there within our communities. So we'll continue to operate on Mondays from 4 to 8. That's largely walk-ins. And then from Tuesday to Friday, we'll be here from 9 till 4:20 is when our last appointment is. And then depending on the day and what our allocation and resources are, we may offer up to 100 walk-ins or add-on appointments Tuesday, Wednesday, and Thursday, potentially up to 300 on Fridays. So it gives people a better opportunity to come in rather than having a scheduled appointment. A little bit about our transition. So we will look at more sites throughout the communities that aren't maybe operated on a daily basis, but maybe we go there once a week, once every couple of weeks to provide a little bit different access. This really builds upon some of the success that's been seen through operations that we've conducted in partnership with other organizations, primarily UVA, who's been extremely important in those mobile clinics, those mobile efforts that have been conducted thus far. Next slide, please. And last night, we did hear news that the CDC, the FDA, and the Advisory Committee on Immunization Practices all recommended and approved 12 to 15-year-olds be able to receive the Pfizer vaccine. And so this is sort of the next phase and the next step in providing greater access to larger populations of the community, and a really critical one too, as we get into the end of the school year, moving into summer, and then hopefully as we get back into school for August and September, we're going to provide a level of protection for those individuals that can allow excuse me, schools to operate a little more safely, minimize risk and mitigate risk a little bit better, and then obviously bring in more students for more traditional in-person education. There's a lot of ways that individuals can get vaccinated, to get their children vaccinated, whether that's through their primary care provider. Some pediatricians are now vaccinating children and their patients. And then obviously there are some ways to get vaccinated here at JCPenney and other locations throughout the district. One more thing I do want to point out, excuse me, there is testing still available for pediatrics at our testing locations. So we operate 3 days a week, Mondays, Tuesdays, or Thursdays in one of the localities. And then we have a fixed location in Charlottesville where we're also offering testing. That testing is free. That's testing for anyone who's interested in it. And that'll be a particularly important resource as more individuals 12 and up get vaccinated, but we still have a significant number of the population who won't have access until at least the fall. And that's speaking of children under the age of 12. So that's something that can be utilized if individuals see it as necessary for their children to get tested. And with that, I'm going to turn it back to Jason.
Thank you, Dr. Bonds and Ryan. We really appreciate those updates. And now that we know a little bit more about what's going on here in the Blue Ridge Health District, we're very excited to welcome our pediatricians that we mentioned at the top of the town hall. And we'll go ahead and actually open it up to questions, Joe, so we can get right into finding out why vaccines are going to be so important for our 12 and up crowd now that we are able to vaccinate.
Sounds good. And yes, if any of our registered attendees would like to ask our panel questions, please click the raise hand icon, or if you're joining us by phone, press *9. Again, we will just entertain one round of questions and one question each. And if time permits, we will continue with that format. And right now, our first question comes from Rachel Hersheimer. Rachel, you're on with the panel. Welcome.
Hi, everyone. Can you hear me? Great. Thanks for doing this. So quick question, with the gas shortage and, a lot of people not scheduling their second dose appointments, or rather scheduling them, but not actually getting their second doses, like Dr. Bonds said. Are you noticing the gas shortage having any impact on people getting their second doses right now?
I can say, being here at JCPenney this morning, we did not notice anyone who's missed appointments. We had a large number of people ready when we were opening up just prior to 9 o'clock, and it's been a steady stream of people who have appointments for today.
So, no follow-up, or am I allowed to ask a follow-up?
Well, Rachel, since there are no other hands raised, why don't you go ahead and...
All right, I'll fire away until someone else. So just to clarify, kids are getting their vaccines through BRHD today, right? You're administering them today?
Yes, we are. We did notice last night that there were a couple of hundred appointments for individuals 12 to 15, and that's held true in terms of what we've seen so far today.
Are there any other hands raised yet? Can I ask another one, or does anyone want to go?
Go ahead, Rachel, ask one more
All
question. We
right.
do have one after you.
And then following up with something that Ryan, you said about the mobile efforts, you want to get vaccines into communities. Are you, do you have any plans right now to roll any mobile vaccination clinics or pop-up sites like UVA is doing right now and in the next week or so?
Well, we've sort of been doing some of the mobile piece already, and I'll sort of clarify what that means. Mobile may not be an actual unit like a van or some sort of medical unit that's taken out. It's more of a location that we use for a single day or maybe once every 3 weeks, given the schedule for the vaccine. It could be at a church, a community center. Eventually, we'll be working with schools directly, and we have been already, to provide vaccine on site. Whether that's during the school day or in an evening or on a weekend where parents can bring their children to get vaccinated. And so that sort of extends where we are out into the community away from these sort of fixed locations. And we'll continue to partner with UVA on figuring out where those locations should be. So looking at some of the data that's down to the zip code or census tract level to see what our vaccination rates are. And really, I think, step up and provide more direct communication, education, and outreach to groups. And then once we've made that connection, built on that connection, then bring in a group to provide access to the vaccine. And so it's really a 2 or 3 step process, and not just necessarily setting up a site and hoping people come to us. There's a harder effort, a more difficult effort that has to be made now to get people who are hesitant to feel more comfortable. And maybe part of that is those community or neighborhood-based locations.
Thank you, Rachel. And next up, we have Mac McKenzie. Mac, you're on with the panel.
Okay, I think you can hear me now. Hey, Ryan, I just wanted to check in and see, my computer's kind of garbled. In June, you say you guys are going to close down the JCPenney site, or I thought that's what I heard. I just wanted to make sure.
Yes, in June, we'll be closing down the JCPenney site and transitioning to a smaller location.
And pardon me, unless Rachel wants to ask another one, I'll get one. I'm just picking on you, Rachel. Is it the idea that pretty much everybody who's going to make it to JCPenney has already had the chance to get there? So now we're going to find those parts of the community that may not have the transportation, may not be comfortable going to a big site, that kind of thing, sort of looking for the folks that we missed with the large site.
Yes, and that's exactly right. We've really noticed the downward trend in first dose appointments. There'll still be opportunities at larger sites. As far as I know, UVA will continue to operate out of Seminole Square at the Big Shots location for the foreseeable future. And just access is greater at this point. Providers are offering vaccine. We have some pediatricians in their offices who are now offering vaccine and have been administering vaccine to 16 and 17-year-olds for the last several weeks. And then obviously the pharmacy program supported by the federal government has plenty of doses. So we've kind of reversed here, where demand has gone down, supply has gone up. And it's really that critical piece of doing the hard work of outreach and education and getting to where people are to get those final few percentage points up where we can get closer to 70, 75, and 80% vaccinated.
Thanks for your question, Mac. And we do have a few other hands raised. And I'll go ahead and we'll just make an adjustment to the question format. If you do have a follow-up, you can ask one follow-up. Next up, we'll have Tim Braden. Tim, you're on with the panel.
Yes, good morning. With the development that's been going on, and now that we're doing pediatrics, is there any talk of the schools mandating the vaccines?
Right, I'll tackle this one. I think this was addressed on an earlier press conference that the state held, and my understanding from their response was that the Department of Education doesn't hold that authority, that it really lies at the legislator level that would have to mandate. I think the approach that we're taking right now here locally is that we're really working with the schools to make it easy for parents to get their kids vaccinated. And perhaps our pediatricians would like to chime in about the importance of this with regard to school safety. But our approach for the foreseeable future will be to encourage parents, to make it easy for parents, and to make sure it's widely available for those adolescents 12 and up. Dr. Armengol or Dr. Vergales, would you like to touch base on schools and vaccinations?
Sure, I'll go first. So yes, I agree with Dr. Bonds. I don't think a mandate would come from a local level. That authority lies at the state level. And we don't foresee that happening, or at least it's difficult to foresee that happening while it's only an emergency youth authorization from the FDA. And with that said, I think what we want to do is continue to educate the populace and let them know that getting a vaccine is really important. It's another tool in the mitigation strategies that we have, including distancing and masking. I know that the Albemarle County schools are planning on having some COVID vaccine days where they're going to be doing it, I think, on certain Fridays. I believe it starts next week. I haven't seen any public statement about that, but I believe they're priming for that. And we're giving it at our office. We actually started unofficially last night, but after the CDC said go, we gave 6 doses, and we have 24 tonight and 24 tomorrow, and I think 100 on Sunday. So, we're giving it here, and we want to make sure that everyone knows that there are many places to go and get your vaccine, and we encourage everyone to go and get it because it's really going to be helpful for opening up the schools in the fall.
All right,
Did
great,
you have a
thank you.
follow-up?
I do not. It was only going to be a follow-up if they thought mandating was happening. So at this time, I don't have a follow-up.
Very good, thank you. Next up, we have Edith Napier. Edith, you are on with the panel.
Can you hear me?
We can.
Good afternoon. My question is that 12 and above are now eligible for the vaccine. And I noticed you said that the young individual must be accompanied by a parent or legal adult. What are you requiring of the student and of the parent in order to say they're being accompanied by a legal adult? Did you understand my question?
We did. So there's a couple of things. We do need to have a consent signed by the parent. And I think our preference, and probably the pediatrician's preference, is to have the parent come so that they have full informed consent of what's going on. The law does allow us to have another adult over the age of 18 act as what's called in loco parentis. So if, for example, you have a 14-year-old who wants to get vaccinated and the parents want them to get vaccinated and sign the consent form, but the parents are working during the time that we have a clinic, grandparent or an aunt or an uncle could bring that individual to the clinic with the signed consent form and act what is called in loco parentis. Now, if the event is happening during the school day and the child is being vaccinated on school grounds, then we can allow the school to act in loco parentis. So again, as long as we have that consent signed by the parent, then the school can, but it has to be a school event. So there's some caveats to that. It has to be more than just on the school grounds. It has to actually be happening during the school, and the school has some requirements they have to meet as well. So if you have an adolescent that you want to get vaccinated, you can bring them yourself to any of the vaccination events that are sponsored by the health department and sign the consents there, and that'll work. If you can't personally make the event, but you have a trusted family member that can bring the child, as long as they have the consent form that's signed, that aunt, uncle, grandparent, trusted family member, as long as they're also an adult, can act in loco parentis. Now that may differ for pharmacies and for some pediatrician offices. They may have other rules. Those are what we follow at the health department. So Dr. Vergales, I don't know, what would you do in a situation like this where you have an adolescent that needs to be vaccinated, but the parent can't bring them to the vaccination or the clinic during that time?
I'll clearly defer to Dr. Armengol more on that answer, but I think it's kind of important for people to understand that we as pediatricians have no interest in acting against the will of the family unit. And so, we're going to do kind of everything that we can to make sure that we're following in best way that we can with what the parents want and wish for their child, and then really make it easier from an access standpoint to be able to accommodate that. But clearly each individual institution kind of has to have its own policies with how to do that. And I would just encourage all parents to reach out to the institution where they're going to get vaccinated to find that, because we're going to always err on trying to be as flexible as we can.
Okay.
And
No follow-up. Can I follow up? This is
Sure,
Edith.
go ahead, Edith.
Okay, my question was, it wasn't to be difficult, but I know being that overnight 12 years old and above are eligible, I'm wondering, will consent forms be at all of the locations, or where can they be located? The appropriate consent forms for minors.
We have consent forms on site at all of our locations, and I believe either now or shortly, you can do that electronically when you register and schedule for an appointment. And so that would be included in the record when it's looked at by staff who are on site here. I don't know if that's happening right now, but it will happen soon.
Ryan, would a note from a parent in their own handwriting or something like that with a signature be sufficient?
I don't believe so. I think it's going to have to be the signed consent form that we provide either on site or what's located on the scheduling system when it's available.
Yeah, I would just say, if you have an adolescent and you want to get them vaccinated and you can't make it yourself, you're a parent and you can't, but you've got a family member who can, call our hotline, and the hotline can help you get the consent form if it's not in the electronic registration system. As Dr. Vergales indicated, really, we want all adolescents to be vaccinated. We really do. And so it is our goal to remove as many barriers as we can while still staying within our state guidelines. So if that's something that you want to do, you can call our hotline, and we'll figure out a way to get a consent form to you. But also remember, we do have evening hours. And so Monday night is an opportunity. And Dr. Armengol, it sounds like you guys are vaccinating in the evenings. Is that what I heard?
Correct. We're doing the 12 to 15-year-olds in the evenings. We're currently doing 16 and above during set hours during the daytime, but we can accommodate just about anybody if they call and let us know. If they have difficulty getting here during the day, if they can just, if they're patients of ours, let us know, and we can make those accommodations as needed.
Thank you for your question, Edith. Next up, we have Lori Tamburino. Lori, you're on with the panel. Lori, are you there? I don't think you are muted, but we will. Oh,
Can you hear me?
We have you now. There we
Okay,
go.
sorry about that.
Sure.
So my question is for Dr. Vergales and Dr. Armengol. I'm curious about what the data looks like with the vaccine, if any medically complex children were included in it, and if it helped decrease the incidence of the multi-system inflammatory syndrome.
Yeah, I can probably take that. Tamrina, good to hear from you as always. So as a general rule, kids with significant medical complexity and autoimmune conditions were not allowed to enter the trial. They were part of exclusion criteria for the Pfizer trial. The Moderna trial had a little bit looser of a definition, so we'll be able to see those results a little bit later. But as far as the Pfizer trial, kids with significant medical complexity, as a general rule, were part of the exclusion criteria, so it was not tested in them. The reason for that is because of the confoundingness of trying to figure out the results of the trial. So it made it really kind of challenging to figure out the results if you had kids with significant medical complexity. With that being said, we're okay with that. Most vaccine trials that have happened over the last decades would eliminate children with significant medical complexity, knowing that we would still be applying the criteria for them. And so when it comes to those kids, we would have no issues whatsoever continuing to recommend vaccination for any type of child with medical complexity. Clearly, the caveat with that would be patients that have autoimmune disease or undergoing active treatments. And then I would kind of encourage people to talk to their individual subspecialty physicians or their individual primary care physicians about the specific child's issue about whether or not they can receive the vaccine at that time. But as a global rule, kids with medical complexity would fall well within the umbrella of what we want. To answer the MISC question, that's also one that's going to be challenging for us to answer because MISC is incredibly rare. We only have about 1,000 documented cases across the country that we feel very strongly actually occurred. And in reality, we only had 1,000 patients per arm in the vaccine trials. So the likelihood that we would have had even one case of MISC was going to be extremely low. And so we won't really know the answer to that question. It's something that as time goes on and we continue post monitoring, we'll see if we found an effect. And logic would assume that we probably would see an effect on those who did develop MISC.
And just to piggyback on that, no one in the trial, either placebo or vaccine, developed MISC.
Well, that's good news.
Lori, did you have a follow-up?
No, thank you so much.
Thank you. Next up, we have Robin Shirley. Robin, you are on with the panel.
Hi, can you hear me?
We can.
Oh, thanks. So I just jumped in a few minutes ago, and I'm so sorry. I hope that this question hasn't been asked before. My child is one of those rare children that falls into that category of undergoing treatment and autoimmunity, and the doctor has written a medical exemption for us. I just have a quick question in that, we're a little bit concerned that schools won't continue to allow those medical exemptions. We don't know if we need to plan to homeschool our child or not.
I can tell you that for no vaccine is that the case. Even the routine childhood immunizations have medical exemptions. And since a mandate isn't going to happen or not in any foreseeable future, I don't think you have anything to worry about in that respect.
Okay. All right. I really appreciate that answer. Thanks so much.
Thank you, Robin. And it looks like we have Rachel back online with us. Rachel, you welcome again. You're back on with the panel.
Thank you. I have a quick question about some side effects that you're seeing in folks who are, 12 to 15 years old. Maybe this is for the pediatricians. What are you doing? Are you working with schools at all? If a child, gets the vaccine and the next day they got to go to school, but they have, a slight fever, is there any sort of excuse that they'll get in case they do have, a fever from the shot?
We haven't had to cross that bridge yet, Rachel. with the adults who got the vaccine, we made exemptions here at our office. I'm sure other healthcare facilities did similar, and I'm sure that other businesses did similar. So if it fits within the time frame that you would expect a side effect to occur, I think it would be fairly reasonable for a doctor to excuse that child and assume that it's from the vaccine. I think that will be a case-by-case situation. And so I suspect that the schools will continue to do what they're doing, which is excluding anyone who has symptoms, which is appropriate. And then those folks will be directed to follow up with their doctor, and the doctor will then make the determination.
Thank you. Believe it or not, I have no questions.
Thank you, Rachel. And I don't see any other hands raised. And Jason, I believe you had a couple questions submitted.
Yes, I will raise my hand. We have a couple of participants who are without a microphone today. So I'll ask on their behalf if that's okay with everybody. And if it's not, we'll go ahead and ask anyway. Let's see. These two questions that we will go through first come from Miranda from CBS 19. And first, Dr. Vergales, we have a question here. Are other vaccines anticipated to be used for this particular age group?
There will be others that have enrolled trials, and so the Moderna vaccine right now is wrapping up their trial, and just like we saw with the other age groups, we would expect to start to see their results soon too. Johnson & Johnson also has a pediatric trial that is ongoing, and so we would not expect that the Pfizer vaccine is the last by any means of the vaccines that will be available for both the 12 and the 15, and as we go down to the much younger age groups after that, they all have the intent of rolling those out to the younger age populations too.
And also the Novavax vaccine, which should be approved sometime this summer, we started enrolling children 12 to 15 in that vaccine yesterday.
Great, thank you both for that. And we do have one additional question, Dr. Armengol, if you want to keep yourself off mute. I think you touched on this earlier, but are students advised to continue wearing masks in class even after being vaccinated? And can you tell us a little bit about the importance of mitigation strategies post-vaccination?
Sure. So currently, there would be no recommendation to end other strategies, even amongst vaccinated individuals. The CDC has relaxed some masking requirements for people who are fully vaccinated and are in outdoor settings, I believe, or in small indoor settings. But in congregate settings like schools, I suspect that we will continue to mask for the foreseeable future, even in a fully vaccinated population. So I think those strategies will continue, and that includes the social distancing, the masking, cleaning frequently touched surfaces, cohorting. Those things will continue for now. If we can get to a point where we're not seeing any cases in the community, Dr. Bonds, I'm sure, could speak to this better than I can. I suspect the CDC might make some different recommendations, but for now, I think we can continue the expectation that masks will be required.
Great.
Thank you so much.
And it looks
Joe,
like
those were the questions that I had in my queue.
Sure, great. And looks like we have Edith with another question, but before we go back to her, I'm just going to make one last call for questions by clicking your raised hand icon or pressing *9 if you're joining us by phone. And we'll go right back to Edith. Edith, you're back on with the panel.
Yes. What are the most prevalent side effects found in the 12 to 15-year-olds, or are they very similar to the side effects that were found in the adults?
So very good question, Edith. If you look at the data that was presented to the ACIP yesterday, 2 days ago, looking at the side effects, they were very, very similar. So, kind of generalized fatigue symptoms, low-grade fevers, some just joint pain and muscle pain. And similar as we have seen with the adult populations, and especially in the kind of older teens and 20-year-old populations, the second dose it seemed to have a little bit more effect than the first dose in that same population. Overall, there was not that to be a large adverse event rate. So that means that we did not see side effects that really caused any other debilitating illness outside of what was more just people's subjective complaints.
Edith, did you have a follow-up?
No.
Thank you very much. And with that, that concludes our questions. And
I've got one more that's one more that's come in. I'm so sorry.
Go for it.
And this may be a great question for one of our pediatricians to answer as well. If, say, a parent has already been vaccinated, or the majority of people 16 and older in a household have been vaccinated, is it still important for someone under that age to get vaccinated?
So I'll just start, but I hope the pediatricians will chime in. Yes, absolutely. Remember, every time we get somebody vaccinated, two things happen. One, that individual is protected, and that's really important because kids do have adverse effects from this disease. We do know that kids can be hospitalized. We do know that a very small percentage, but nonetheless, a certain percentage will suffer the adverse outcomes associated with it. So it's really critical for their safety. But importantly, it's also critical for the safety of the community and other extended family members who may not be able to be vaccinated. So absolutely, we need everybody to be vaccinated. Dr. Armengol, Dr. Vergales, you want to chime in on that one?
I would totally agree with Dr. Bonds in that sentiment. The more people we can vaccinate, the better the likelihood is that we'll overcome this pandemic.
Would echo that as well. We just encourage everybody to get vaccinated with the safety and efficacy of this vaccine. It truly is our ticket out of here at this point.
Jason, I'll send it back to you for any closing remarks.
All right, that's wonderful. Well, I first just want to say thank you so much to the city for your help in broadcasting this town hall today, and absolutely our panelists today, Dr. Denise Bonds and Ryan McKay from the Blue Ridge Health District, and Dr. Armengol and Dr. Vergales as well. The expertise has been incredible, and I just want to reiterate that this is not the only time to ask questions. The health district, your pediatricians, and trusted resources in the community are always available. For ours specifically, you can reach us through our Blue Ridge Health District hotline, where you can send us an email, and we will be more than happy to answer any questions during a town hall or after a town hall. And if you need an appointment for your vaccine, or if your children are ready for their appointments, let us know, and we're all on your side. So thank you so much for being here today. And until next time, thank you, and stay safe and stay healthy.